Hello, everyone, and welcome to this webinar from the Société Santé en Français. My name is Adam Berada. I'm a public relations officer, and I will be your host for the next 60 minutes. Today, we'll be talking about collective bargaining in the health sector, and our speaker will be Mr. Sébastien Huard, lawyer at Emond Harnden law firm. Hi, Sébastien, and thank you for being with us today.
Thank you, my pleasure.
This webinar is held in partnership with the Réseau Franco-Santé du Sud de l'Ontario, represented today by Ms. Gabrielle Laurin, who is a project coordinator at the network. Hi, Gabrielle, and thank you for being with us. So,
You're welcome.
prior to begin, maybe a few words about the Société Santé en Français for those who are not familiar with our organization. So, SSF is a dynamic national association whose objective is to promote the development of French language health for Francophone and Acadian minority communities in Canada. SSF is a hub of 16 regional, provincial, and territorial networks working in concerts with partners that are involved in improving access to French language health services in all provinces and territories where French is not the majority language. The SSF acknowledges that our offices located in Ottawa are on the unceded and surrounded territory of the Algonquin Anishinaabe people, whose presence here reaches back to time immemorial. The SSF honors the traditional territories upon which our staff and partners live, work, and play. So, a few words about our speaker today. Sébastien Huard is fully bilingual, and he has considerable experience in the public and private sectors, with particular focus on municipal and federal government, healthcare, and transportation. Sébastien provides counsel on judicial reviews, labor arbitration, wrongful dismissal claims, governance issues, human rights, collective bargaining, labor disputes, WSIB claims, privacy matters, and proceedings before the Ontario Labor Relations Board and Public Service Staff Relations Board. Sébastien was selected as Business Person of the Year in the private sector by the Regroupement des gens d'affaires de la Capitale Nationale and Francophone Business Group in 2022. In 2023, he was recognized by the best lawyers in Canada for his expertise and work in labor and employment law. He's also a member of the Association des juristes d'expression française de l'Ontario, the Canadian Bar Association, the Regroupement des gens d'affaires, the Advocate Society, the Human Resources Professionals Association of Ontario, and is a former board member of Joan of Arc Academy. He graduated from both the common law and civil law programs at the University of Ottawa. So, Sébastien, the stage is yours.
Thank you, Adam, and I wanted to thank le Réseau Franco-Santé du Sud de l'Ontario and la Société Santé en Français for inviting me to speak today on a primer on collective bargaining in the health sector, which will also include a discussion on bilingualism and in particular the need to offer French services. And so we'll be covering a lot of ground in the next 60 minutes. So let's begin with a discussion on collective bargaining and the basics. So what it means in concrete terms when we're looking at a collective agreement, it's the contract which sets out the terms and conditions which will govern the terms and conditions of employment of employees who are represented by the bargaining unit. So, and when I say represented by the bargaining unit, it means those individuals that are captured by the bargaining certificate. So that's the jurisdiction of the union. So they represent a group of employees, and typically they'll say all employees of ex-employer, save and except those employees who hold a position that is supervisory or higher than a supervisory position. So that's generally what you would see in a traditional bargaining unit certificate. And what that means when you are unionized is that the employer cannot negotiate terms and conditions with employees individually, because the entity that has responsibility to negotiate those terms is the bargaining agent. So the union acting on behalf of a group of employees to set down terms and conditions of employment, which will govern the employment relationship for a period of time, whether it's for a period of 2 years, 3 years, 4 years. The duration of collective agreement will vary from agreement to agreement. And so the collective agreement becomes the employment contract. And when I say the employment contract, for those employees who are non-unionized, they are governed normally by whether a written employment agreement or a verbal employment agreement. And when you are unionized, of course, it's the collective agreement that will be the governing document to govern the terms and conditions of employment of the employees. And when you're bargaining, it involves concessions, it involves trade-offs, it involves compromise, and no agreement is perfect. And it's up to the parties to fashion an agreement that will be satisfying to both of them. And I'll speak later on in my presentation on the different mechanisms that exist when the parties are unable to freely negotiate an agreement. But the goal, of course, is always to attempt to reach a freely negotiated agreement at the table. So when we look at collective bargaining, there are a number of pieces of legislation, depending on the province in which the employer is operating in, which will govern the terms and conditions, the framework for negotiations, the dispute mechanism that's in place. And so that will vary depending on the province. And of course, for those employers that are subject to the Canada Labor Code, or federally regulated employers, I should say, it will be the federal statute that will govern your terms and conditions of employment. A good example being, for example, banks or railways, or, and of course, employees that work for the federal government. They will be subject to legislation applicable to them as federally regulated employers and employees. And so the provincial labor legislation will provide, as you can see from the slide, a statutory timetable for negotiation. So when must notice to bargain be provided? It will also stipulate, in some cases, if notice to bargain is provided, then the parties are subject to what's called a statutory freeze. I'll speak more to that in a moment. The requirement to negotiate in good faith, so to make reasonable efforts at the table to reach an agreement. So not to take positions that are so untenable and so unreasonable that the purpose or the objective is to frustrate the process. Also, legislation will set out a dispute resolution mechanism, so conciliation. So someone from the Ministry of Labor who will be there to assist the parties in attempting to reach agreement. And that conciliator, who at some point can become a mediator, does not have the power to impose or bind the parties. That person is there to facilitate the process. And in some cases, it's arbitration that will be the dispute resolution mechanism, either by statute or because the parties, even though it's not prescribed by statute, will voluntarily agree to refer their outstanding issues to a third party who will then make a final and binding decision on the outstanding terms and conditions of employment. And one thing to note is, for instance, in Ontario, in the healthcare sector, hospitals, long-term care, also known as LTCs, will be required to go to arbitration in the event that they are unable to come to a freely negotiated agreement. And there are other sectors where arbitration is the mechanism to resolve disputes. And in the absence of arbitration, then the traditional path, as you would have seen through the news media, is a strike or a lockout. So more to come on that. And in some provinces, for instance, like I can think of paramedics here in Ontario, will be required to negotiate an essential services agreement, and you also see that at the federal level as well, before they may engage in a workplace dispute. And so that is an example where you have to identify essential positions or a number of positions that will not be able or permitted to engage in job action because we have to ensure that the essential services are available to the population. The legislation will also speak to provincial legislation. In some cases, will speak to what's required in a collective agreement. For instance, a grievance process. So what happens if the parties disagree on the application or interpretation of the collective agreement? The legislation will say you must, employer and union, include a dispute resolution mechanism with respect to the application and interpretation of the collective agreement, known as a grievance, which ultimately gets referred to arbitration for a rights arbitration. The legislation will also speak to the operation of the collective agreement. So what happens when collective agreement expires, and also what happens if the employees, the members of the bargaining, wish to terminate their bargaining rights. So they effectively, we do not wish to be represented by a union anymore. And then also this legislation across the country will speak to unfair labor practice complaints. So what happens if as an example, employees engage in an unlawful strike, or the employer or the union engages in bad faith bargaining? That will give rise to what's typically called an unfair labor practice complaint, which gets heard by the labor relations board of the respective province. So depending on the province where you are operating your business, then there'll be a board, and in Ontario it's called the Ontario Labor Relations Board, and so they are called labor relations boards, and they will hear these types of complaints. And then the legislation will speak to the enforcement. So what are the powers of these administrative boards to enforce, to impose, have enforcement mechanisms, I should say, when there's a violation of the legislation, or when the employer or the union or employees are not complying with their statutory obligations. So in terms of the collective bargaining framework in the healthcare sector, each provinces will have sort of their legislative or their statutory framework, and in some cases there will be what's called centralized bargaining, or local bargaining. So centralized bargaining is that, for instance, where you'll have an organization, and you see that for instance, in BC, in Ontario, in the hospital sector, as an example, where you will have an employer organization acting on behalf of a number of hospitals negotiating terms and conditions applicable to all the hospitals across province. And then you will have local agreements that will be negotiated to speak more specifically to local operational issues that affect that hospital, that institution specifically. So you see that in Ontario, in BC as well. You have a similar regime applicable to healthcare workers across the province, and you also have something similar as well in Nova Scotia as well. So typically agreements get negotiated per establishment, per organization, but there are instances, there are examples, such as the three examples I provided you with: Nova Scotia, BC, and Ontario, where agreements get negotiated at a central level. And when you're looking at collective agreements, they're typically separated by the types of occupation groups, right? So you'll have an ONA collective agreement representing, as an example, nurses in Ontario, and then you'll see, for instance, OPSU here in Ontario representing paramedics, representing RPNs, physios, psychologists, and then you can have the QP group as well, representing perhaps more clerical workers. In some cases can include paramedics, in some cases can include RPNs as well. So a very sort of varied structure across the country in terms of how things are organized by unions in terms of who they represent. And as you can see from the slide, the various multiple employer organizations one of them being the Ontario Hospital Association or the Employers Association of British Columbia, again, negotiating on behalf of a group of employers. So, and all of this would involve multiple unions participating in this process. So in terms of collective bargaining, in terms of steps, the steps are, in general, right? Notice to bargain. So either party gives notice that they wish to commence bargaining. There's a principle of statutory freeze as well, which means that when the parties are negotiating terms and conditions of employment, the terms are frozen until a new collective agreement is negotiated. The duty to negotiate in good faith, the obligation to engage in negotiations to make proper attempts to reach a collective agreement, doesn't mean that the employer or the union can't engage in hard bargaining. They just can't engage in what's called as surface bargaining. So make-believe bargaining, where you're not really making reasonable efforts to reach an agreement. And as well, if the parties can't come to an agreement, as I indicated, then there's in most provinces, there'll be a step whereby the parties can go to conciliation or mediation. And in some cases, as I indicated, the matter may be referred to arbitration where the legislation so permits, or where the parties agree voluntarily to refer the matter to a third party. In some provinces, there will be a mechanism whereby the parties can send the matter to where the employer and the union can't come to an agreement. The employer presents an offer to the union. The union refuses to bring it forward to its membership. The employer can put forward what's called a last chance offer vote, or a supervised vote, which will be supervised by the Ministry of Labor to allow the employees to vote directly on the offer. It's the only occasion or opportunity for the employer to speak directly to the employees about the merits of their offer. And if the parties are unable to come to an agreement, then they can go on strike. And there are time limits that will be spelled out in the various legislation across the country, or the employer can lock out its employees and say you're not coming into work. We're preventing you from coming to work while the parties are attempting to negotiate an agreement. And then if the parties do reach an agreement at the table, so between the employer and the union, then that matter has to be sent to the membership, so the employees, the members of the bargaining unit, to vote on this offer. And if 50% plus one of the employees who show up at the vote say yes, then you have a binding collective agreement. So in terms of the process, so the notice to bargain, as I indicated, will start the process for bargaining. And it's either written notice provided by the employer or the union, signaling to the other side that they wish to commence bargaining. And the legislation in each province will typically stipulate when bargaining must commence once you've received the notice. And for example, in Ontario, it's 15 days from receipt of the notice to bargain. And theoretically, if either party refused to sit down within those 15 days, the union or the employer could file a bad faith bargaining complaint under that example. But typically, the union and the employer will agree on bargaining dates and then commence the process for bargaining. And once notice to bargain has been provided, that triggers the statutory freeze. So as I indicated, it means that the terms and conditions of employment are frozen and the employer cannot change the terms and conditions of employment of its employees while the collective agreement is being negotiated. That statutory freeze will cease to apply once the parties are in a legal strike or lockout position. And typically, the statutory time limit to meet will vary between 10 and 20 days, depending on the jurisdiction in which you are operating. With respect to the statutory freeze, what it means is that the employer cannot change terms and conditions, which will include rates of pay, without obtaining the union's consent. The duration of the freeze will vary depending on the province, and the statutory freeze will be in place until the parties acquire the right to strike or lockout. And a point of sort of nuance is if the statute says in the event of a dispute it must go to arbitration, then of course the statutory freeze remains in place until a decision is issued by the arbitrator with respect to the outstanding terms and conditions of employment. So in terms of when the statutory freeze will end in Ontario, BC, Manitoba, it ends when the parties are in a legal strike or lockout position. And similar concept in Newfoundland, Nova Scotia, and PEI. So those are the specific sort of provisions in those provinces. There are some provinces which will allow changes while the statutory freeze is in place. For example, in Alberta, it speaks to established customs or practices, or in BC, you must make an application to the board. And in Ontario, it's the business as usual test, which means that what was anticipated in terms of probable changes. So very technical, but those are some of the nuances that are applicable in those provinces. So in terms of the duty to bargain in good faith, so what it means is the parties must, and when I say the parties, the employer and the union must make a genuine effort or attempt to reach a first collective agreement. And again, this concept of making efforts versus surface bargaining. You can engage in hard bargaining, but you can engage in surface bargaining. So effectively taking positions that are so unreasonable that it's designed to ensure that that agreement is never reached. For example, if the employer said, employees are being paid $40 an hour, and the economy is going relatively well, and the business is going relatively well, and the employer says, we want to reduce all the salaries from $40 an hour to the minimum wage, and there's no actual basis, there's no rationale for doing so. That may ultimately lead to a bad faith bargaining. And the same would apply to the union if they're taking positions that are so untenable and so unreasonable that it's there's no legal basis for them to hold certain positions. So there's the duty to there are two obligations that are sort of contemplated by labor legislation. Often they're concurrent. So this idea of bargaining in good faith and also making reasonable efforts to reach an agreement. So other examples of bargaining in bad faith: failing to meet with the union, or the union is unwilling to meet with the employer, being unavailable to meet, where the employer bargains directly with employees without going through the bargaining agent, without going through the union. Those are examples of bad faith bargaining practices. So when you are bargaining, it's important to set out the ground rules. So what that means is in terms of how the parties will conduct themselves at the table. So courtesy, respect, letting others speak. What happens if the parties reach an agreement on certain items at the table? So you'll want to sign off on agreed to articles. So you're memorializing what has been agreed to. Ensure that the parties are prepared before each day of bargaining. Perhaps some communication, so joint communication or blackouts, or we're not going to speak with employees about what's happening at the table. The schedule, the number of days that will be set down for bargaining, and the frequency of meetings. In terms of the bargaining itself, so you want to make sure you have well thought out positions, that you have one person speaking at the table, that it's a coordinated effort. You want to ensure you have, as I said, clear communication at the table. You want to be watching the other side to see their reaction, their body language, to get a sense. You want to get as well as just from a timing perspective, in terms of when you say yes to certain demands. So if you say yes too quickly, it may signal to the other side that you have more to give from a negotiation perspective. And one of the ground rules of bargaining is you don't give something if it doesn't have any value for the other side. And if it doesn't, don't give it away. So you want to take your time, you want to be alert in terms of table tactics, and you want to take very careful notes of what's happening at the table. Note keeping is critical. It happens where there is a dispute about what was understood about a certain provision, what the intent was of that provision. So it's very important to take very careful notes, literal notes of what's being said at the table, time, dated, who was present at the bargaining session, who's speaking. And so very useful to take notes and make sure you've got at least one person who's effectively your note taker. Okay. So in terms of third-party involvement, as I indicated, the legislation will provide, in most cases, for a conciliation mediation process. So conciliation being a third party who will be there to assist, a public servant there to assist the parties in reaching an agreement. And it can either be at the request of the parties or it can be imposed by the minister. And strikes, the conciliation process is a prerequisite in most provinces before the parties are able to engage in a labor dispute. And that would be the case in New Brunswick, Newfoundland, Nova Scotia, Ontario, PI, and Saskatchewan. So what happens if there is an impasse? So short of those provinces where there's a statute that says you must go to our interest arbitration to resolve outstanding issues, then the union can go on strike. So the members will exercise their right to strike, provided they've had a vote, a majority vote allowing them to go on strike, or the employer can lock out its employees. So in order for there to be a strike, it requires the parties to have at least met and bargained. Some legislation will require that there be conciliation, as I indicated before, any sort of job action can be taken. And as well, if the union is refusing to bring forward an employer offer to its membership, then there can be what's called a final vote offer, a supervised vote, which provides an opportunity for the employer to articulate its position and make its pitch to the employees about why they should accept the employer's offer. So there's a few provinces that have this feature. So Manitoba, Ontario, Quebec, Saskatchewan have this feature, but Newfoundland, Nova Scotia, and PI do not have this option of a final vote or a supervised vote. So what happens when there is a strike or lockout? There are, in certain provinces, there'll be an obligation to negotiate an essential services agreement, and Alberta, BC, and Manitoba have this type of feature. So does New Brunswick, Newfoundland, Nova Scotia, Quebec, and Saskatchewan. Ontario has one as well for its paramedics. So effectively, you must have this agreement in place or before any sort of job action can be taken. And in some cases, if there can be mandated arbitration when maintaining essential services substantially interferes with meaningful bargaining, and you see that in legislation Manitoba, New Brunswick, Newfoundland, Nova Scotia, and Saskatchewan. So those employees that have been identified as being essential employees are not permitted to engage in a strike or to be locked out. And the essential services agreement must be negotiated before a strike or lockout can commence. And as you can see from the last bullet, in some provinces, the board can order mandatory arbitration if the maintaining essential services substantially interferes with meaningful bargaining. So the other option as well is arbitration, which is available in some provinces where there's mandatory arbitration in the health sector, or the parties can voluntarily agree to it, to refer the matter to an arbitrator, so a third neutral party who will determine the outstanding terms and conditions of employment and impose a new contract on the parties. And there are provinces where there is mandatory to go to arbitration, and that is in Alberta for ambulance operators, in Ontario it's for hospital, long-term care, retirement homes, which are covered by HILDA, and PI for hospital, ambulances, nursing homes, and community care facilities. So, okay, so moving on now to bilingual positions. So most provinces, as you can see from the slide, have adopted either a legislation or a policy with respect to language services. What's available will be different from province to province in terms of the right to have health services in someone's language of their choice, or have services in designated areas. So some legislation will stipulate that you are in a certain area and therefore you are entitled to French services. For example, in Ontario, there's legislation to that effect. And there may be French language services rights, but not specifically for healthcare. So in terms of the legislative framework for French language services, so for instance, the right to health service in the language of someone's choice is prescribed in New Brunswick. The right to French services in designated area and or for designated services is prescribed or set out by statute in Manitoba, Nova Scotia, Ontario, and PEI. And then there are French language services rights, but not specific to healthcare services in Alberta, Newfoundland, and Saskatchewan. And there is no French language legislation in BC. And so even where there's no legislative mandate in place, French health services are available in all provinces. For example, the French Health Services Program of Alberta Health Services has the objective of providing access to healthcare for people who speak French, and to collaborate with community stakeholders to expand access to French language health services. And the majority of provincial frameworks for French services specifically refer to active offer, and that's the case, an active offer of French services, which would be the case in Alberta, Manitoba, New Brunswick, Ontario, PEI, and Saskatchewan. And what's important for you to understand is, in the context of collective bargaining, the employer can identify or designate certain positions as being bilingual, or having the requirement to have someone who's capable of speaking, writing in French. And so even if the legislation doesn't require you to provide French services, you as the employer, given your management rights, are entitled to designate certain positions to provide French services. So it's always subject to the reasonable exercise of management rights. So there has to be a basis for it. And you need to be ready to justify that designation. The French proficiency of the position must be relevant to the duties and responsibilities of the position. Ideally, the language requirement for a designated position would be set out in a policy that details which services positions are bilingual or French and the proficiency required. And when you're determining whether language requirement and proficiency are required, you should consider the language requirements of the position, the proficiency requirements, and of course, the lowest level of proficiency required to fulfill the duties of the position to avoid challenges by the union. So It's and when you look at the type of clients that you're serving, the population, the area that you're in, is what legislation applies to you, and so on and so forth. So you want to really consider those factors as you're assessing the need of the position. It's not designed as a nice to have. There's really a basis for designating positions as being bilingual, and there's lots of arbitral case law on that. I can think of a few decisions in the hospital sector on that specific issue, job posting grievances relating to the designation of positions as being bilingual. An Ottawa hospital decision comes to mind on that front. So the in terms of designated bilingual positions in a unionized context, so you will you must understand that if the union may grieve it if they feel that the requirement is not justified. So the importance of doing your homework, having a proper basis for designated positions, and it could be addressed through collective bargaining as well, in terms of identifying the needs for certain positions as being bilingual, and the need to have employees who are proficient in both official languages. So, and it's important for the employer to communicate the need for it, having policies, clearly articulating your position, why you need to have certain positions. But again, if there's a proper basis for it, it'll be difficult for the union to challenge the employer on the need to have employees be bilingual or be proficient in French and English. So in terms of collective bargaining, in terms of preparation, like what do you need to do as an employer as you prepare for your first round of bargaining, whether it's a first collective agreement or the renewal of a collective agreement? And so it's essential to prepare, to set out a bargaining strategy, to have a mandate from your board or from upper management. You want to determine who's going to be on your committee, and you want to ensure that you're assembling or putting together comparator data. How do we sit vis-a-vis our comparators? How do we sit vis-a-vis other like or similar organization in our area, other hospitals, other long-term care settings, other community health centers? How do we compare to those organizations? So you want to ensure that you look at you want to consider, I should say, your business needs. Like, what do you need as an organization to be successful, to achieve and meet your current business obligations? Do you need to contain costs based on the financing formula that you have, or the funding formula that you have with the government or with another agency? What are your labor relations needs? You would want to do a collective agreement audit. Look at your collective agreement. Are there some housekeeping issues that need to be addressed? Are there inconsistencies? Is there any ambiguity? Are there past practices that are inconsistent with the strict terms of the collective agreement? What types of grievances have you had over the years? And what are the common themes that arise from those grievances? So all these things will inform your bargaining strategy as you prepare for bargaining. And you'll want to consult with the key personnel. You'll want to consult with senior management, frontline supervisors. What types of things are they seeing, and what types of changes are they hopeful the employer can make at the bargaining table? In terms of looking at from a monetary perspective, you will want to look at your CPI data, the Bank of Canada information, or what's provided by StatsCan, or in some cases by the major banks. More importantly, you will want to look at recent settlements. What's being negotiated in your sector from a wages perspective, from a vacation perspective, from a benefits perspective? Like, what are the trends? So you want to be alive to those issues. And in terms of sort of the more normative conditions of employment, so the So non-monetary terms and conditions, what's sort of normative in your sector? So you want to be aware of these things, because on the other side with the union, they will have that information because they have researchers, they have people assisting them in preparing and building their bargaining strategy. In terms of preparing as well, you will want to anticipate union proposals. And how do you anticipate? So you look at what types of complaints have we received? What types of grievances have we received? What are the trends in the sector, normative trends? What are the bargaining trends in our sector and area? And what's the history? Like, what did the union propose last round? And if they didn't achieve it last round, you can expect that they will bring forward those proposals again. You will want to cost the current collective agreement entitlement. So what are those costs to the employer currently? And of course, what, based on the mandate that you have, what are the increased costs that the organization will need to sustain in the face of increases in terms of wages, benefits? So you need to have a proper understanding, a proper grasp of those costs, so you can go to your board, go to your CFO and explain to that person what they're facing in terms of increased costs, so they can budget and forecast appropriately. And then you will want to cost the union's demands as well to see how that sits vis-a-vis your budget, and again goes to your ability to meet the mandate that's been provided to you either by upper management or by the board. So in terms of preparation, you will want to look at the bargaining team, so the size and composition, the roles. So you want to have someone who understands operations, you want to have someone who understands finance, and you'll want to have a spokesperson. So typically a bargaining team will be comprised of 2 to 5 people. You want to ensure that the people who are at the table bring value, that they're there to assist. A large bargaining team with members who are not contributing is not useful. So you want to make sure that you have people that are bringing value to your bargaining team. You want to ensure that you have a bargaining mandate, either from your board or from upper management. What will be the communication strategy? So of course you can't communicate with employees while bargaining is ongoing. So you want to limit the amount of communication being provided outside of the bargaining table. And you want to start planning. What happens if there is a strike or there's a lockout? You need to be prepared to ensure continuity of operations. So, and in terms of contingency planning, again, does the legislation require the parties negotiate an essential services agreement, and so on and so forth. And just going back on the theme of communication, we will want to, as I said, limit the amount of communication that's provided to employees. And typically the rule is no communication with employees while bargaining is ongoing, unless the union goes out of its way and issues communications which are fully untruthful, in which case you can correct and correct any sort of false or misleading statements provided by the union. So in terms of collective bargaining trends, which of course will have an impact on your bargaining, you want to consider inflation, cost of living, and what I can say on that is that, of course, there's been, as we know, since COVID, lots of upward pressure in terms of wage settlements, and you've seen that in particular in the healthcare sector, where wages have increased in a pretty dramatic fashion. Just in terms of the typical annual averages in terms of increases that we've seen, if you look, I think in 2016, it was 1.2%, 17, 1.7, 2018, 1%, 2019, 1.6, 2020, 1.9, and 21, 1.9. And then you see the spike, 22, 2.8%, 23, 3.4%, 24, 3.4%. So you clearly see in the past years an upswing in terms of the average annual wages going up in the education, health, and social services sector. And there have been more job actions in recent years, in part because of this inflationary pressure, where the unions are applying pressure on employers to put more money on the table. And we saw some job action in Manitoba, in Quebec. There was a large strike, as everybody knows, with the federal government, 155,000 public servants that went on strike. And because of COVID, and at least may not be so much the case in 2025, but issues about recruitment and retention, you saw unions being more demanding in terms of what they need, in terms of improving terms and conditions of employment, in particular as it relates to benefits and wages. So that's my presentation, and of course, I'm happy to take any questions if there are any, and I wanted to thank everyone who's online for their attendance at today's presentation. Thank you.
Thank you so much, Sébastien, for the presentation. And I see that we already have questions here. So the question is, I understand that the Ontario Public Service Employees Union is moving towards open bargaining versus the blackout communication we normally see. Any special considerations about this?
Well, I think it's a very interesting strategy. I'm not sure how successful it's going to be. I mean, time will tell. Typically you want to sort of air out your dirty laundry in a more sort of contained setting. I think having this kind of open bargaining may cause issues in terms of the ability of the parties to reach an agreement. And what you may see, in particular in the healthcare sector, where there's a requirement to go to arbitration, the hospital sector, long-term care, and that includes as well as municipally operated homes for the aged. More matters going to arbitration because it's going to make things very difficult for OPSEU, I think, to reach a negotiated agreement at the table with this type of open type of negotiation. So,
okay, thank you so much. Just a reminder for our audience, you can raise your hand so we can unmute your mic if you want to speak, or you can just ask your questions in the chat box on the Q&A. Or maybe we have something. Okay, not yet. In the meantime, I have some questions for you, Sébastien.
yeah.
And this one would be about the current trends. So, do you see an evolution in the place given to bilingualism or French language services in recent collective agreements?
So interestingly enough, this issue of identifying bilingual positions, it can be a matter of discussion at the table, but often where you see more of a conversation is when in the context of jobs being posted by the employer with a specific requirement for language services, and that gives rise to grievances. And often just to what happens is you have someone who is bilingual, that fulfills all the requirements of the job, and you have someone who's unilingual and does not meet the language requirements, but has more seniority than the person who's been identified and selected for the position who is bilingual. And that's where you see a debate about the need for bilingual services. So that's why it's critical for employers to really prepare their file. And what I mean by that, identifying the position, the needs, doing a proper business analysis. So when the union comes forward and says, well, why did you select someone who's more junior to this more senior employee? You're able to properly defend your case and have a well thought out and articulated positions.
Okay, thank you. And also, are there any example of model clauses that facilitate the introduction of bilingual positions without creating tensions?
Right. So typically, an ideal clause will say, and you'll find that provision under the seniority clause in a collective agreement, which will say the employer will select applicants based on their skills, ability, knowledge, and requirements, and where those factors are relatively equal or the seniority will trump. So that's a clause which gives more weight to skills, abilities, qualifications. And a skill could be, of course, the ability to speak French or English, and to be bilingual. So you want to have that kind of flexibility in your collective agreement to make those appropriate choices. So yeah.
Okay, I still see no questions. In the meantime, can you tell me, please, how can French language service obligations be reconciled with the principle of union equity for all workers?
Well, right. So in terms of this principle of equity for union workers, nothing is equal. I'll tell you that. So start with that principle. So, and at the end of the day, the employer has the right to manage its workplace, and the employer, just like the employees, are there to serve their clientele. And so there are instances where, and often in many cases, where it's unfair, and it's unfair because the employer has a need to have certain skill set to meet its objectives, or whether it's a legislative mandate, or whether it's a mandate provided by its board or another organization. And on that basis, they must exclude certain individuals because they don't have the appropriate skill set. And in this particular case, the proficiency to operate in both official languages could be the ability to speak properly, could be the ability to write properly, and so on and so forth. So yes, unions are there to try and level the playing field, but the limits are that the employer must manage its workplace, and managing in some cases means excluding certain individuals because they're not meeting the reasonable job-related needs of the position. So.
Thanks again. Okay. Can you give us a concrete example of a negotiation that led to a major breakthrough for workers or for French language services?
Well, an example would be, well, the easiest example I can provide you. I'm not sure if I'm not going to suggest major breakthrough, but it was a breakthrough. So, for instance, at the federal level, right, in collective agreements, you will have a bilingualism premium or bonus, right, and in collective agreements. And so I think that's in some respects it is a breakthrough which has been in place for many years, and that was to recognize that the value of bilingualism for organizations, so the ability to have individuals who are able to operate in both official languages, at least that's the theory of it. So I would say that's certainly a breakthrough in terms of recognizing the value, which is a skill set in of itself, of someone being able to speak in both French and English. So yes.
Thanks again. We have, maybe Gabrielle, do you want to ask some question?
I have lots of questions. Thank you, Ada.
Please go ahead, be my guest.
I'm just trying to figure out which one I want to ask because I have too many. So in the process of when you hit an impasse or a deadlock, especially when there's language issues involved, how can those be addressed? Do you have any tips for everybody today, just in regards to the language piece?
So just in terms of like at the table where there's like a language barrier, or
yeah, I didn't think of that one, but yeah.
well, so to start, I mean, you would hope that could be avoided, right? So first of all, if and I've seen that happen, right? If like where you have a bargaining unit which is represented by, which is primarily French speaking, as an example, right? And the representative for the union is a unilingual, right? And so that can create, even though that person, the other members are able to speak in English, it can in some cases create some tensions at the table, right? And sometimes not tensions with the employer, but even tensions amongst themselves as well. But if there was a situation where there was a language barrier at the table, I mean, that's very problematic, right? So you would probably have to have like translation or being made available. You often see, I'll say this, for instance, in litigation. What I mean by that is you have an employer that is a francophone organization. The employees working for that organization are francophone, but the lawyer that's representing those employees is a unilingual and does not speak French. So your question may be, what happens in those cases? So the employer has the right to proceed in the language of their choice, and it would be up to the union in that case to pay for translation services at their own cost, because they've appointed knowingly someone who's unable to speak in both official languages. So
Thank you so much.
Thank you, Sébastien. We have another questions in the chat box. So in healthcare environments, there is a lot of strain on budgets. So given the trends of larger general wage increases and other bargaining related costs, so any tips for getting an appropriate mandate approved?
So I think the key exercise that you need, and again, that's a very fair question. There's we are in a more restrictive sort of economic environment at the moment, and it depends on. So there's two ways of responding to this question. First, you have to understand like how you sit from a negotiation perspective. So what I mean by that is, does the employer have the ability to lock out its employees? And if there was a workplace dispute, are you able to continue to operate? And if the answer is yes, that gives you leverage right at the table. So very important to understand, like, what's my worst case scenario, and what leverage do I have at the bargaining table, versus if there is no agreement, then we go to our arbitration, and an arbitrator will look at trends and we'll try to replicate what's been negotiated in other sectors, similar sectors. But in terms of preparation, you want to look at the trends. What I mean by trends in your sector. So for instance, if you're negotiating in the long-term care sector and you're operating a not-for-profit home, you would want to look at other not-for-profit homes and see what's being negotiated by way of wages in terms of benefits. And you would go to your board and say, look, you may not give me this mandate, but understand that if we go to arbitration, the arbitrator is going to provide for these increases. And so in some cases, boards will say, I'd rather a third party impose those terms and conditions on me employer, versus us voluntarily agreeing to it. That's it. But the idea is to clearly articulate what those trends are, look at other collective agreement, gather the information, which is exactly what I do when I'm bargaining. I have my research team look at trends in the sector. We prepare charts, look at all the wages and benefits, and we see how we sit vis-a-vis our comparators. And then when we seek our mandate, we tell a very clear and compelling story to the board or to upper management in terms of, this is what you're looking at, and this is what we need in terms of mandate. Otherwise, all right, employees may go on strike, or you may find yourself in arbitration.
Thank you so much. We have another question here from Julie Lantin. Hi, Julie. I think in case if the case goes before the court, so does the judge have to be francophone as well?
So I can give you the Ontario example. So in Ontario, there are designated regions, right? And if you're in one of those designated regions, Ottawa being an example, Toronto being another example, and I'll just kind of like expand a little bit on that question. So the employer wishes to proceed in French. The other side wishes to proceed in English. Okay, let's assume an employee suing their employer for wrongful dismissal, for termination. The employee retains counsel, who's an Anglophone. The employer says, we're going to proceed in French. And let's say the litigation occurs in Ottawa or in Toronto. You're entitled to proceed in French. It's going to be a bilingual hearing, and the judge would need to be bilingual. They would appoint a bilingual judge to hear the case, for sure, with that example. So
Thanks again. So, do you have another question? If not, it's already the end of this webinar. So thank you again, Sébastien, for being with us today. Thank you, Gabriel, for representing the Réseau Franco Santé du Sud de l'Ontario.